Okay, now let's start with the new MCQ series. Now start. A 12-year-old girl with cystic fibrosis has been readmitted to the hospital in acute respiratory failure as a result of infection. Physical therapy in the form of bronchial hygiene should ऑप्शन है हमारे पास ए है नॉट बी एडमिनिस्टर्ड सिंस इट इज contraindicated in acute respiratory failure. B administered 2 times a day to the patient all, and C है be administered vigorously 3 times a day, and D can be administered vigorously once every 2 hours at least 6 times a day, and the correct option is option D, be administered vigorously once every 2 hours at least 6 times a day. While ambulating a patient in the PELT bars, you lose control and the patient falls, hitting her head on the bar. Okay, the patient lies motionless on the floor between the bars, bleeding heavily from the scalp laceration. The first thing you should do is option A है put thin gauze over and apply manual pressure to the scalp bone. B है check for responsiveness. C है call emergency medical services. D है immediately determine the patient heart rate and blood pressure, and the correct option is check for responsiveness. Next, you are treating an outpatient 3 times per week. The physician's referral indicated diagnosis of acute subacute bursitis. Okay, initial evaluation आपने की, उसमें रिवील हुआ कि एक्टिव शोल्डर फ्लेक्शन इज पेनफुल है 8/10 and limited to 75 degree. After 2 weeks, pain is 5/10 and abduction is 95. At the end of 3 weeks, again pain is 6/10 and then abduction is 88 degree. In this case, you should option A है modify the treatment and continue 3 times per week. B modify the treatment and increase to 5 times per week. C contact the physician and seek guidance, and D है discontinue treatment since it is unethical to treat a patient who is not benefiting from the treatment, and the correct option is A. हम modify करेंगे treatment को and continue करेंगे 3 times a week. During pregnancy, the presence of hormone relaxin can lead to abnormal movement and pain, which most frequently affect the option A है glenohumeral joint, B hip joint, C lumbosacral joint, D sacroiliac joint, and the correct option is SI joint, sacroiliac joint. यही अफेक्ट होता है बेसिकली प्रेग्नेंट वुमेन में. A patient with angina pectoris has been instructed to use sublingual nitroglycerin in the case of angina attack. This medication will help to ease the situation primarily by the option A lowering blood pressure, B decreasing resistance in the peripheral vascular, C है increasing venous return, D है increasing cardiac afterload, thus decreasing the work of the heart, and the correct option is option B, decreasing resistance in the peripheral vasculature. Next, an 8-year-old with severe spasticity in the lower extremity receives a new wheelchair. The patient is average in height and weight for his age. Okay, funding restrictions limit the selection to only the standard wheelchair dimension as supplied by the manufacturers. As a physical therapist, you should recommend the selection of option A narrow adult chair, which allows for growth since funds for future wheelchair will be scarce. B क्या है junior chair with a standard seat depth of 16 inches and seat width 16 inches. C है child chair, sometimes called junior 13, with a standard seat depth of 13 inches and seat width of 16 inches, and D option है tiny tot chair with a standard seat depth of 11.5 inches and seat width of 12 inches, and the correct option is C. जो है ना जूनियर 13 जिसको कहते हैं चाइल्ड चेयर विद द स्टैंडर्ड सीट डेप्थ ऑफ 13 इंचेस एंड सीट विड्थ ऑफ 16 इंचेस. अच्छा जी, a treatment plan for patient diagnosed with benign paroxysmal positional vertigo would most likely emphasize option A gaze stability exercises, B canalith repositioning treatment, C posture stability exercise using a Swiss ball, D have vestibular feedback to facilitate normal movement, and in this case correct option is option B, canalith repositioning treatment, that is most likely emphasized during treatment of benign paroxysmal positional vertigo. अच्छा जी, 3 days following a CVA cerebral vascular accident, a patient is fine in bed. It would be best to position the upper extremity so that the scapula is protected and upwardly rotated and the shoulder is abducted and extended. B option क्या है scapula is protected and upwardly rotated and shoulder is abducted and rotated. C है scapula is retracted and downwardly rotated and shoulder is erected and rotated, and D option है scapula is retracted and downwardly rotated and shoulder is abducted and externally rotated, and the correct option is option A, स्कैपुला प्रोटेक्ट होगा, अपवर्डली रोटेटेड होगा एंड द शोल्डर इज अबडक्टेड एंड एक्सटर्नली रोटेटेड। इसको हम एयरप्लेन स्प्लिट पोजीशन भी कहते हैं। ये हम बेसिकली सीवीए के पेशेंट में ना ये पोजीशनिंग बेस्ट होती है। अच्छा जी, an acceptable modified positioning today in the posterior basal segment of the left lower lobe is to position the patient. Option A has side lying on the right with the pillow on the right hip. B है prone with the pillow under the hips and bed flat. C has side lying on the right with the pillow between the legs and foot of the bed elevated 18 inches prone. And D option है prone with the pillow under the hips and bed elevated 18 inches. And the correct option is B, prone with the pillow under the hips and bed flat. When the ankle is forcefully inverted and plantar flexed, okay, the ligament that most likely disrupted is option A deltoid होगा, B है anterior talofibular, C posterior talofibular, and D है calcaneofibular. And the correct option is anterior talofibular. अगर आप ये मूवमेंट करें ना, अपने ऊपर फील करें, लाइक इन्वर्जन करें फुट की एंड देन जो है ना प्लांट फ्लेक्शन करें, देन anterior talofibular ligament है ये डिस्टर्बेड होने के चांसेस हैं। अच्छा जी, a therapist cut her finger with a kitchen knife. Okay, on the same morning was scheduled to do open wound care on a patient who has HIV. In this case, she would option A had not treat the patient, B bandaged her cut with an occlusive dressing and don gloves normally, C treat using normal strength precaution, D double glove. तो ऑप्शन ए करेक्ट है, नॉट ट्रीट, हम पेशेंट को ट्रीट ही ना करें क्योंकि HIV है और फिर रिस्क इन्फेक्शन स्प्रेड के ज़्यादा हो जाते हैं ना। अच्छा जी, फिजिकल थेरेपिस्ट नोट इन द मेडिकल रिकॉर्ड दैट अ पेशेंट शी इज ट्रीटिंग इन रिसीविंग अ न्यू medication. Therapist unfamiliar with this medication determine its purpose. It would be best if the patient first call the patient physician, ask the nurse in charge of the patient, call the pharmacist, ask the patient during the treatment session. And the correct option is option B, ask the nurse in charge of the patient. Okay, अगर आपको नहीं समझ आ रही तो आप उस जो है ना वो नर्स से पूछें। You are performing a physical examination of patient in a custodial care facility which includes observation of a lesion on the left heel. Okay, based on the characteristics of the wound, you would classify it as A stage 1 lesion, B stage 2 lesion, C stage 3 lesion, D stage 4 lesion, and this is stage 3 lesion, जिसमें ना बेसिकली फैटी टिश्यू भी इन्वॉल्व हो जाते हैं। अच्छा, clinical status of a truck driver with a posterior herniated nucleus pulposus has improved if option A है peripheral pain increases only when the lower extension is attempted, B है peripheral pain occurs only when the straight leg raising, C है pain centralizes with passive hyperextension of the spine, D है there is flattening of the lumbar lordosis. And the correct option is pain centralizes with passive hyperextension of the spine. ओके, जब सेंट्रलाइज पेन हो जाए, हम हाइपर एक्सटेंशन करवाए पेशेंट की, तो इसका मतलब है कि पेशेंट इंप्रूव हो रहा है। अच्छा, यू आर वर्किंग विद अ पेशेंट विद ALS, amyotrophic lateral sclerosis, who has a tendency to aspirate food. You should advise the caregiver that option A है hyper extension of the neck make swelling easier, B warmer solid food aspirates more readily than cooled solid food, C solid food aspirate more readily than liquid food such as soup, and D liquid food such as soup aspirate more readily than solid food. And our correct option is option D. in this case जो है ना वो liquid food aspirate होने के chances ज़्यादा होते हैं। When instructing the family of a 9-year-old boy with Duchenne muscular dystrophy, the main emphasis in the lower extremity should be placed on option A has strengthening of the knee extensor and plantar flexor, B strengthening the plantar flexor and stretching the hip extensor, C stretching the hip flexor and plantar flexor, and D strengthening the hip flexor and knee extensor. And the correct option is C, stretch करना है हमने hip flexors को और plantar flexors को। अच्छा जी, उसके बाद नेक्स्ट आ जाता है 18-year-old female soccer player with the Q angle in excess of 30 degrees exhibits patellofemoral attacking problem. While playing soccer, it would be best if she wore a patellar stabilizing brace with a lateral buttress, B है patellar stabilizing brace with a medial buttress, C है neoprene sleeve with a patellar cutout, and D है derotation brace. And correct option is option A, patellar stabilizing brace with a lateral buttress. And the next is a 69-year-old man with diabetes mellitus has had a stage 3 decompression ulcer over the right scaphoidoplasty for the past 5 months. Okay, the ulcer is infected with the staph aureus and necrotic tissue covers much of the wound. The physical agent that would be least helpful and not usually recommended to treat the problem would be option A, low voltage constant micro एम्परेज डायरेक्ट करंट, बी है हाई वोल्टेज मोनोफेजिक पल्स करंट, सी है व्हिरलपूल, डी है मॉइस्ट हॉट पैक। एंड मॉइस्ट हॉट पैक ना हम लीस्ट हेल्पफुल है और हम रिकमेंड नहीं करनी चाहिए इस पेशेंट को ट्रीट करने के लिए। इन ट्रीटिंग अ 5-year-old child with spastic diplegia as part of the program, relaxation must be accomplished by option A है use of rhythmical stabilization, B slow rocking, C inhibition of parasympathetic fibers, D facilitation of sympathetic fibers, and the correct option is B slow rocking। slow rocking आप करवाए ना सिक चार्ट पे तो बहुत इफेक्टिव होती है। अच्छा, कैप्सुलर टाइटनेस हैज लिमिटेड योर पेशेंट्स एबिलिटी टू फुली एक्सटेंड हर लेफ्ट नी। ओके, ट्रीटमेंट टू रिस्टोर जॉइंट मोशन शुड एम्फसाइज। ऑप्शन ए है anterior glide and externalization of the tibia, B है anterior glide and externalization of the tibia, C posterior glide and externalization of the tibia, D है posterior glide and externalization of the tibia, and correct option is A anterior glide and externalization of tibia। अच्छा जी, while administering a phonopharesis treatment to a patient with subdeltoid bursitis, the patient informs you that she is HIV positive. Okay, this information was not part of the patient record. It would best to option है discontinue the treatment since phonopharesis may be harmful in this case, discuss the patient as the next stop meeting, continue treatment the patient as usual, and refer the patient back to the orthopedic physician who is apparently unaware of her HIV status। ठीक है ना, तो हम जो है उसको फिर जो है ना वो कंटिन्यू करेंगे ट्रीटमेंट द पेशेंट एज यूजुअल। अच्छा, the result of isokinetic dynamometer indicate that patient can generate a peak torque of 120 with her right quadricep muscle and only 80 with her right hamstring muscle। ठीक है, the situation indicate that option A quadriceps torque generation is excessive, B hamstring torque is insufficient, B C है both quadricep and hamstring torque generation is excessive, and D है torque generation is proportionally correct, and the correct option is D दिस इज करेक्ट। जो टॉर्क जनरेशन है ना उसकी प्रोपोर्शनैलिटी के लिहाज से। When using ultrasound in treating chronic bursitis of the hip, the most beneficial might occur if the ultrasound frequency and dosage are option A है 1 MHz and 1.5 watts per centimeter square, B है 1 MHz and 0.5 watt per centimeter square, C 3 MHz and 1.5 watts per centimeter square, D has C 3 MHz and 0.5 watt per centimeter square, and correct option is A 1 MHz and 1.5 watts per centimeter square। अच्छा जी, patient present with the red beefy granulating bone, the dressing that would be inappropriate to apply B A है occlusive, B wet to wet, C hydrophilic, D wet to dry। wet to dry जो है ना वो inappropriate है। When performing under and water ultrasound, the most important safety factor is that option A है कि हमने pot being treated should not be immersed in a immediate metal tank, B transducer head keep moving, C ultrasound apparatus is connected to a ground fault interruption circuit। ठीक है, and D है piezoelectric crystal is not correct। तो correct option है यह कि जो हमने safety factor कौन सा consider करना है कि जो है ना वो देख रहे हैं कि ultrasound apparatus is connected to a ground fault interruption circuit। When recommending a wheelchair for a patient with a lesion of T11 resulting in paraplegia, the modification least needed by patient with this disability would be option A swing away footrest, obviously ये हमें चाहिए होगी modification, B high seat back, C pneumatic tires ये भी चाहिए होंगे, D caster locks ये भी चाहिए होंगे, and B correct option is B हमें ना जो high seat back है ना पेशेंट का कंट्रोल आ ही जाता है। उसके बाद नेक्स्ट है damage as a result of the Salter Harris type 4 supracondyle humeral epiphyseal fracture in a young athlete most likely result in option A refracture at a future time, B non-union, C arrested growth, D severity of severing of radial nerve, and the correct option is C arrested growth। Next, if the patient is placed in the spine position with the head flat, okay, the posterior drainage is optimal for the option A है apical segments of the upper lobe, B posterior segments of the upper lobe, C है anterior segments of the upper lobe, D है lateral segments of the upper lobe, and the correct option is anterior segments of the upper lobe, C option। A weightlifter with hypertrophy of the scalenus muscle complains of the pain and paresthesia in the right upper extremity when lifting the weight overhead. Okay, it is most likely a manifestation of option A, thoracic outlet syndrome, B, vertebral artery obstruction, C, cervical radiculitis, C, complex regional pain syndrome type 1, and the correct option is ऑप्शन ए, thoracic outlet syndrome. ये सारा कुछ ना thoracic outlet syndrome का सिनेरियो. उसके बाद है a patient is immersed up to the neck in a therapeutic pool. Okay, while exercising the patient therapist should take into consideration the physiological effects of the immersion which result in significantly A, increase post vital capacity, B, increase expiratory reserve volume, C, increase work of breathing, D, decrease pulmonary blood flow, and the correct option is C, increase work of breathing. Next है when using TENS, okay, to help modulate pain, one electrode is placed on the posteromedial thigh and the other on the posterolateral calf. Okay, the dermatome involved in this case would be option A HAAD2, B HAAD4, C S2, D S1, and the correct option is option C S2. A patient with chronic asthma has been admitted to a hospital for an acute expression of the disorder. The most important thing for the physiotherapist was check when seeing the patient for the first time is option A है current medication, the patient is checking, B previous history of the disease related to the patient current status, C interpretation of the most recent chest x-ray, and D है pulmonary function test results, and the correct option is pulmonary function test results. D option correct. You have assessed the deep tendon reflexes of patient recently diagnosed with amyotrophic lateral sclerosis. The results are 2 plus left, 3 plus right. Your interpretation is that reflexes are option A diminished on the left and normal on the right, B normal on the left and exaggerated on the right, okay, C exaggerated but within normal limits on both sides, and D exaggerated on both sides. Okay, तो जो है ना बेसिकली डीप टेंडन रिफ्लेक्सेस की जब हम बात करते हैं ना अकॉर्डिंग टू माय पॉइंट ऑफ व्यू, जो इसमें जो है ना एक अपर मोटर न्यूरॉन डिजीज़ है ना, तो लेफ़्ट 2 प्लस लेफ़्ट है, इसमें तो हम नॉर्मल कंसिडर करेंगे, ठीक है, और एक्सैजुरेट तब ही होंगे जब टोन भी ज़रा ज़्यादा ही हो जाएगी, तब भी हम कहेंगे ना कि एक्सैजुरेट हो गए हैं. तो करेक्ट ऑप्शन हमारे पास इसमें बी होगा. A 5 foot tall, okay, 37-year-old word processing technician complains of lumbar discomfort at a full day, okay, at her computer workstation. To help this situation, you would not recommend that she try option A, use of a lumbar roll, B, use of elevated footrest, C, moving her chair further away from the keyboard and screen, C, and D option है taking frequent short walks during the day. ठीक है, और हमने क्या रिकमेंड नहीं करना पेशेंट को, मूविंग हर चेयर फर्दर अवे फ्रॉम द कीबोर्ड एंड स्क्रीन, दैट इज नॉट सूटेबल. अच्छा जी, while crossing the finish line of a 100-meter race, lead and fell on her dorsiflex wrist. Okay, she immediately complained of pain and tenderness, but the radial aspect of the wrist in the anatomical snap box. Na, you suspect of possible fracture of the option A है lunate, B है capitate, C है scaphoid, D है hook of hamate, and the correct option is C. scaphoid पे ना पेशेंट को चांसेस ज़्यादा होते हैं. यहाँ पे जो फ्रैक्चर है ना एनाटॉमिकल स्नैप बैक्स में आप देखें ना तो आपको scaphoid फील होती है ना. अच्छा, a patient with traumatic pain injury is being transferred from an acute care facility to a rehabilitation hospital. In terms of the physical therapy, this transfer would constitute option A, discontinuation of care, B, discharge following a single episode of care, C, continued single episode of care, D है multiple episodes of care. तो जो है ना बेसिकली हम जो है इसमें करेक्ट ऑप्शन करेंगे C, continuation of a single episode of care. Okay, you are working with a 12-month-old with a developmental level of 3 months. Okay, appropriate intervention at this stage would incorporate option A, pivot prone positioning, B, rolling from prone to spine position, C, rolling from spine to prone position, D, training on supported sitting, and the correct option is pivot prone position. A patient with Parkinsonism disease is hospitalized. Okay, he is ambulatory but requires close supervision to patient to prevent falls. Okay, the physical therapist intervention should option A है request that patient remain hospitalized in order to work on balance perturbation until safe. B है request a prescription for wheelchair since this would be the safest method of locomotion, and C option है train caregivers in contact guiding prior to discharge home, and D include the time up and go test, and the correct option is हम क्या करेंगे C, train caregivers in contact guarding prior to discharge home. Next, a physical therapist is treating an 80-year-old female at home. The patient is in the early stage of amyotrophic lateral sclerosis. The patient lacks endurance to independently ambulate to and from the bathroom. However, she refuses to use the bedpan. This has caused added difficulties and stress for the family members caring for her at home. In this situation, the therapist should, option A है, begin immediately ambulation, endurance training with a distance to and from the bathroom as the primary goal. B है, recommend that the patient can be transferred to a skilled nursing facility until she has sufficient endurance to get to and from the bathroom. C है, recommend for immediate delivery or commode chair to deal with the situation. D है, try behavior modification to convince the patient to try and use the bedpan until changed sufficiently to get and from the bathroom. And the correct option is जो है ना option C, recommend for immediate delivery of a commode chair. And next is if the sign indicate by the diagram positive intervention should focus on the strengthening of option here left gluteus medius, B right gluteus medius, C left quadratus lumborum, C right quadratus lumborum. And the correct option is A left gluteus medius. ठीक है, ये नॉर्मल स्टैंडिंग पोजीशन है और ये जो है ना लेटर पेल्विक टिल्ट अगर जिसको हम कहते हैं, ये जो है ना अब नॉर्मल टर्नबर्ग साइन जो कहते हैं पॉजिटिव है. तो बेसिकली इसमें हमने स्ट्रेंथनिंग किसकी करनी है, जो है ना वो राइट साइड की करनी है ना, सॉरी लेफ्ट साइड की करनी है कि जो है ना वो पेशेंट जो है ना वो स्टेबल है कि ना लेटर पेल्विक टिल्ट को मेंटेन रख सके. अच्छा जी, नेक्स्ट है you are working with a patient who exhibits fluent aphasia. Okay, this form of aphasia is usually characterized by option A है normal auditory comprehension, B very slow speech, C impaired reading and writing, D impaired articulation. And fluent aphasia जो होता है ना उसमें बेसिकली पेशेंट की क्या इम्पेयरमेंट आ जाती है, रीडिंग और राइटिंग में उसकी वोकैबुलरी लिमिटेड होगी, उसे पता ही नहीं चलेगा मैंने क्या लिखना है ना, उसे रीडिंग में डिफ़िकल्टी आएगी. एंड नेक्स्ट, अच्छा जी, 3 months following a left CVA. Okay, the patient is receiving home care physical therapy. The patient is out of synergy and demonstrates score of 6 on functional independence measure. Okay, motor learning strategies at this junction should focus on option A है use of mental practice to improve performance, B breaking complex tasks down into component parts, C use of random practice orders of related tasks, and D है consistency of performance in variable environment. And the correct option is basically हमने consistency अब करनी है performance की और environment को change करना है. If arterial line dislodge while treating a patient, okay, the first thing to do is option A है call the nurse, B clamp the line, C apply direct pressure to the site, D elevate the limb. And in this case हमने apply direct pressure to the site, option C is correct. The use of diagnostic imaging with multiple sclerosis to help determine disease activity and how well intervention is working is option A of no use, B most sensitive when using magnetic resonance imaging, C very specific when using computerized tomography, and D only determined by the use of transcranial sonography. And the correct option is B most sensitive when using magnetic resonance imaging. जी आगे है, a hospital volunteer is assigned to help out in the physical therapy department. Under normal circumstances, it would be inappropriate for volunteer to option A change linen or clean whirlpool following a patient treatment, B transport patient to and from the department, C help patient transfer from their wheelchairs to the treatment tables, and D schedule the times for department in service education. And the correct option is option C help patient transfer from their wheelchair to the treatment table. ये जो है ना inappropriate है कोई भी volunteer के लिए ना एक्शन परफॉर्म करना. ठीक है, आगे जी, thank you and keep watching and hopefully you like it, and please subscribe my channel.